Good evening, Team Auricle. It's fantastic to see all our medicals here tonight. I'm your host, Dr. Rishika, and I'm thrilled to have with us exceptional Dr. Naval, who is our Chief ENT Educator at the Auricle platform. With over more than 5 years' experience in teaching MBBS students and FMGs, she is known for her engaging approach and her fantastic style to simplify all the concepts in ENT. So, for her passion for teaching and the unwavering support for her students, it has earned a very special place in their heart. So, welcome you, ma'am, for this interview. And before we begin this session, I would love to know about your MBBS journey and what motivated you to be a med educator.
Thank you so much, Rishika.
Yes,
Thank
ma'am.
you so much for such a mind-blowing, bombastic introduction.
It's my pleasure, ma'am. It's my pleasure.
um, it was, see, actually, MBBS is never a cakewalk for anyone, be it a 4 year
Definitely.
experience or a 7 year experience. Anyone who passed out within 4 years without any backlogs, it has never been easy for them, and it will never be easy for anyone who has backlogs. It's never a cakewalk. It's learning about the whole human body, understanding how it works, understanding the natural mechanism of human body. So of course, it's a different experience. It's a roller coaster ride. Never easy and never the same for anyone. And my MBBS was never easy, of course. I started teaching when I was in my second year of MBBS. uh, that's when I started educating people because I feel like, when you teach more, you learn more. So knowledge is a treasure which never be emptied. No one can rob knowledge, right? So it's something that you should pass on and something that you should give it to other people. And in that way, you gain respect from other people. And of course, you will get more knowledge. So I have been teaching students from my second year of MBBS as a part-time teacher. And then my third year, followed by my fourth year and my internship. And even now, I'm teaching students. And I think it has been a great journey for me. And I enjoy teaching students all the time.
Exactly, as you said, like the most important part, like to pursue anything, that you should be very passionate about it, be it teaching, be it clinicals, anything. And definitely, like
Yes.
MBBS is not an easy journey. It's like a roller coaster journey. And definitely, ma'am, I have faced this thing as a student in my med journey. Like we lack guidance. We don't have anyone to guide us in this whole journey. So, like today, for today's medicals, we have a platform like Oracle who is there with them from their first day of joining MBBS till the day they add doctor to their name. So, ma'am, I would love to know more about this. Like when I was in third year, I faced a lot of problems in ENT in understanding concepts. So, can you please tell me like what a student should focus on and what are those tips and tricks how they can excel in ENT?
Okay. So I think students, they take first year very seriously and second year very
Yes,
seriously,
ma'am.
but third year is somewhere, you feel like, okay, we have three subjects, ENT, Ophthalm, and SPM, and
Will
we'll just
chill.
brush it up, yeah, and we'll chill it. But no, that's not the case. Of course,
Yes,
you will
ma'am.
have backlogs, maybe in one subject, two subject, or maybe three subjects, right? And
Yes, ma'am.
like I say, ENT, your ears are always outside, external organ. So that's how we keep ENT books away from our eyes, away from our sight, because we always want to keep it outside, right?
Yes, ma'am.
Ear is a very, very complex subject, right? You have to know whatever we study here in ENT and MBBS undergraduate, it's just the tip of the iceberg. We have a
Yes, ma'am.
lot more to study when you do specialty and subspecialty. And
Yes,
it
ma'am.
is very, very important that you have basic knowledge of ear so that you can excel in future in that subject. So I
Okay.
feel ENT should not be neglected, but doesn't matter what I feel. That's actually what happens is that all of us just want to, take it so easily, study whatever we know and just go write exam because we think, oh, what's there in here? It's just external, middle, and internal ear. That's it. But that's actually not the case. There are so many diseases that we should know, so many organisms that play important role. Microbiology plays very, very important role in ENT. Most of the ear infections you can only diagnose with the specific organisms, and the only way you treat ENTs, if you know the organism, you can give the antibiotic, right? So
Yes,
I
ma'am.
think ENT is very important, and also especially for people who are pursuing pediatrics, they should have a good hold on ENT because this is most usually a common condition that you will see in neonates, children, under 18. You will see this more commonly in those people. So I think it's an important subject. See, in MBBS, there's nothing that's not important unless and until you're not interested in that. But I think every subject is important, and ENT should also hold equal, pedestal on that platform. Everything should be equal. Yeah.
Exactly, ma'am. Like as you mentioned, like ENT plays a role in like it is linked to all the subjects, be it pediatrics, be it anatomy, like microbiology is also linked with it. And ENT, it becomes a little bit difficult because we are not able to visualize all the structures like we do in all other subjects, you know. So that might be the reason students are not able to, take a lot interest in ENT. But I think like today's medicals are really lucky when they have educators like you to guide them and teach them for this subject. So, ma'am, like what are those like essential steps or the resources and the tips that a student of third year should prefer to read this subject? What
Okay.
resources
That's
they should use?
Yeah. So this is a very a nice question. I think, just like you told me now, ear is something that you have to know imaginary, right? Because
Exactly,
it's
ma'am.
unlike other body parts. You just have to accept the external ear. All the other parts you have to imagine. So, yes, I know, and we all are aware that, today's social media platform is exceptionally vast and overwhelming. You type anything and it's there. Your visuality is not compromised. You can find all the videos, all the structures available, be it on YouTube, Instagram, Facebook, or wherever you follow, right? But before that, when social media platform was not a boom, then how did we
Yes,
have
ma'am.
ENTs back then? How?
I
Were
cannot
they not able to
imagine.
imagine? Yeah. So this is all, you should boost your imagination capabilities. Of course, reading books, not see, visualizing, watching videos, it might help. But when you read books, it creates your imagination. Like if you read a scenario in a book, you imagine that scenario, and that's how you hold control over your imagination. And I think I advise it's not just for ENT, for anyone who says that, it's difficult to imagine certain things. I think
Definitely.
they should work on their imagination, and that's how we do. We read books, we do paintings, painters, they imagine and do paintings and all that. Coming to ENT part, the best tip that I can give you is that love what you hate. When you start loving what you hate, that's when you start loving it. You know what I mean? It's proportionality. So ENT, if you don't pass ENT, you don't pass MBBS. So it's either you have two choices. It's just to hate it and keep on failing, or to love what you hate and to, pass over it. You must need the resources for ENT. In India, we all
Yes, ma'am.
follow Dhingra, very
Yes,
very
ma'am.
common book that a lot of universities in uh, India follow that. If we come out of India, we have good books. We have one book called Secrets of ENT, commonly used during internship ENT rotations. So here we have something called clinical rotations or clinical observationship. So you don't get paid here, of course, but you can have rotations in
Yes, ma'am.
a specific department where you like. So what you can do is you can use those books. So students there, they use ENT secrets book. And there is one more book of Whaley Blackwell. Whaley Blackwell. It's called ABC of ENT. These are international books, of course, but I think students who are following Oracle, they can use Dingra. Apart from that, anyone who's very, very interested in ENT can follow these big books like ABC or ENT. We have a lot of books. A lot of books we have. Yeah.
So I'm like what Oracle plays role in this, like simplifying the whole hard work, because today's medicals are like not into reading textbooks and though and that too international books they'll not go for it. So how can you please tell us like how Oracle has designed its note or its resources to help such medicos who are not into book reading?
Yeah. So actually, see, platforms like Oracle are actually being created by the students. So by the educators, so that they can help students who are not interested in reading and who are more who don't have enough concentration in their 45 minutes of class. Like in India, we have 150, 100 set of a batch of students, right? So not everyone have enough concentration. Like maybe some of them might be exhausted and this and that. So they can come to this platform and use it like their classroom. Now here, again, Oracle is a very, very good idea for students to utilize this platform as their university. Let's say Oracle is like a small medical university where students
Yes,
of their
ma'am.
specific years can use this platform in a very, very fruitful way if they use it in a good way. Again, what can I say? It's like, you cannot force the student to sit and study, but if Oracle is something which might create interest in the students, because all the educators here are, I feel, are very expert, and they are teaching student in a very well mannered way. And these days, students, they don't want to hold their bags, walk to the classroom, walk to the universities. They
Definitely,
just want
ma'am.
to be in their blankets, open their laptops, see 15 minutes of class, and, just sleep there. So I think students
Exactly,
who are
ma'am.
more like Gen Z generation, this is for them, of course. Yeah, I feel it like that.
Exactly, ma'am. So, ma'am, can you please tell me more about like how these live classes are designed? Can you please tell me more about the teachers, the live interactions, the recorded classes, how they benefit the students?
Sure. So when we come to live class, before we have a live class, we have a whole big management who's working on this live classes. So we have workup of live classes. We prepare for live class like 5 days prior to the class day. So the management, they make sure that they extract all the important questions from all the question banks, all the previous years of question papers, and they make the list of most repeated questions. And they make sure that even after we do that, we make sure that we cover up all the chapters in the reader with covering the important set of questions that will definitely come in the exam. So there is
Yes,
a
ma'am.
huge team working behind us in each department, not just ENT, in every subject, who make sure that they extract questions from those question banks from last year question papers. Choose what's more repeated, and how many marks of question do we have. Like this question might have many marks, this question might have this many marks, and then we get a list of those questions, and then we are here live teaching them online. you know this is
That's
how it works.
amazing, ma'am. Exactly, ma'am. Like I have never heard of any platform like who, is providing live lectures, recorded lectures as well as questions, and who is working more on providing the best of the best questions from the previous year questions so that students can score well in their exams. So, ma'am, you
Yeah.
know it, like I have also suffered with this thing. Even after studying a lot, we face difficulty in, exhaling in the written exams. We don't know how
Mhm.
to write the exams, how to focus on the speed and everything. And no, trust me, no one is there in this medical university to guide us through this. So, how Oracle plays role in guiding the students in clearing their professional exams with such a good marks?
I totally agree on this, that teachers in India, no matter what, so exceptional lecturers we have, so exceptional professors we have, but majority of them fail to train the student how to present their answer in the exam hall.
Exactly,
That's
ma'am.
exactly where we all lose marks. And that's exactly what even I faced in my first year. So no matter how much information you have, if you don't know how to put it on your answer sheet,
It's
examiner is
useless.
not there to sit and read your stories. right? You might write a whole paragraph out of a topic. Examiner is not there to, he'll be like, okay, I have 100 papers to correct. I'm not going to extract important information from this paragraph and give a marks, right?
Exactly, ma'am.
So he might just, give a swift look and might give you, if even if you wrote everything on that paper in that paragraph, he might just give you 2 marks. You never know, right?
Exactly,
So
ma'am.
it is very important for you to, give a brief layout on that particular question. Again, I'm pointing not just ENT, every subject. It is very important. And for that, I think ENT Oracle has a very, very, very strong hold with this thing that they will teach their students how to present the answer paper, how to write the answers in the exam so that the examiner gives you full marks. For example, let's say if we have a topic, since I'm teaching ENT, I'll give you an example of ENT. If it comes like otitis externa, just like now we had a live class, right? So the
Okay.
student might read everything from Dingra and he will write exactly what's there in Dingra. He might buttify the answer, right? He might be very intelligent. He might buttify the whole topic and he will write the whole topic the way it is there in the reader. Examiner will not read the whole thing again, right?
Definitely, ma'am.
So
Exactly,
there
ma'am.
is a
That's the
rule.
problem.
There's a rule. There's a rule. The rule is that if it's an otitis externa, right, you have to define what it is so that the examiner knows, like, okay, she knows what is otitis externa. Then you define clinical features, etiology, if it has an etiology, clinical features, and then treatment, prevention, if it has a prevention. Same goes with anatomy. Since I also teach anatomy, with anatomy, anatomy, it is very important that if they ask you a muscle, origin, insertion, nerve supply, action. This is the way you
Yes,
write
ma'am.
muscles in anatomy, right? So this is very important, and I think Oracle is doing a great job on this way that teaching students how to write the answer in the exam hall. So I think if every student joins this class, this platform, I think they will never fail on how to write the exam. Apart from that, if they're joining Oracle, they know how to write the answer, but they don't go and study and go and then they fail. Then that's not our case, right? But then they should know how to write the answer. That's very important, and this is what we are working on, I think.
Exactly, ma'am. Like, you know what? Like, this platform is so good. Like, it pushes student to score well in their professional exams. And rest of
Yeah.
the platforms are there. They focus more on like MCQs and just clearing the PG exams and all. So, like, that is the problem. Like, I have heard from all the medicos they face at the end of their university exams. Oh God, like that was my mistake. I was not able to read the textbooks. Oh God, I was not able to write my answers so beautifully in the exam. So I'm glad like today's medicos are having such a platform who is guiding them to score in their professional exams as well. Mom, one more question I have. Like, what do you think? Like, how important previous year questions are? What role do they play? Because when I was in my third year in, like, I used to run behind my professors, resident, ma'am, please mark some few important questions or topics that are going to come in our exams. So, what do you think? Like, do the student have to read all the topics equally, or they should prioritize some topics to score good in their
See,
exams?
yeah. So here, I think that, you cannot say that, nothing, there are specific important things that we should learn for the exam. Not everything is important. If you don't study that important, let's say, for example, we extract important questions from the previous year question papers and we teach students on that Oracle platform for that.
Yes, ma'am.
But doesn't necessarily mean that the topics that we don't cover is not important. It's not
Yes, ma'am.
important for your third year. But when you sit for an FMG exam or when you sit for a
Yes,
next
ma'am.
exam, that will come up. You cannot run away from the topics which are not covered. So,
Exactly, ma'am. We have
it
to.
is yeah, you have to study everything. Being a doctor, you should know which nerve is coming from which part and entering which part. If that's not an important question, doesn't mean you will never come through that topic ever again in life, right? So everything is important. I don't believe that nothing is important. There are few important questions that we should study, and there are specific topics that we should know. No, that's not the case. We should know everything. Okay, and I think a very important thing in India is that, 4 years is very unjust for MBBS. Four
Yes,
years
ma'am.
is very unjust for MBBS. First year, it's like, just out of 12 months, we can just count 9 months we have for first year. And second year, we have 18 months somewhere, right? Third year, again, we have 9 months. And final year, again, we have, I think, 9 months, right? So I think it's very unjust. So students, what they can do is they can use this platform to not waste time and study whatever important we mark. And Oracle is working on that, and we are trying to take include those topics also, which will come in next exam, and which are the topics for FMGs, because we have back uh, back team who's working behind the screen also, who are students who are preparing for FMGs and who have already sat for FMG exams. So of course they are more experienced as well. So we are also covering those topics which are there in FMG or next. So previous year question paper, you asked me like, what's important for how important is the last year question paper. So whatever that comes in last year question papers are the most common things that a doctor will see in his clinical life.
Yes, ma'am.
Okay, so we make sure that the student is sure short clear about that topic, and we examinate him. So that is the only question, that is the only reason that we have repeated questions, that we say student, okay, these questions are important, we'll have questions from previous years of 10 years of question paper. It is because those topics are important, not because they hold something. It is only because those are commonly occurring scenarios, conditions or vignettes that you will get in your clinical practice. But rest other things that we have in our books are also equally important, because there are some uncommon
Yes, ma'am.
conditions that we will face, right? So everything is
Definitely, ma'am.
important, but previous 10 years question papers are important, so that you pass your academics. Doesn't mean that you get previous year 10 years question paper, you buttify the whole answer and then go sit right in the exam.
No,
No,
no, no,
that's
no.
not the case. If you do that in theory, you will not be able to pass in practicals, right? Theoretical way, you can just verify the answer, go write it on the paper and pass. How will you do it in your practical session if you don't have the IQ to make a reel out of that thing? You know what I mean? Yeah.
Yes,
So
ma'am.
that's there.
Definitely, ma'am. And really, our conversation about this thing, this perspective, reminded me of one of the quotation I read somewhere. Like, every lesson is important. Every week, very, very careful while reading every lesson because it's going to save someone's life one day. So
Yes,
definitely
definitely.
students should focus on each and every topic and not just because it's going to come in their exams or something, because it can be one of your clinical case when you are dealing in OPDs or your
Yeah,
IPDs.
yeah,
Definitely.
definitely.
So, ma'am, one big problem that I have faced as a medico is our MBBS lectures. You know, like when I was a student in my first year, second year, in fact, right now too, I attend my classes just for attendance only. So, because there are some teachers or some professors who just came and read out the PPTs, and it's really boring. Like it is not an interactive class. You are good, I accept it, but few classes are very boring. So ultimately, we have to study everything on our own. So, what do you think? Is there any solution to this problem?
Okay, so I think I never faced this problem that we had in education on PPT. I know PPTs are very boring, and I think Gen Zs are
Yes,
very
ma'am.
unlucky in this matter. Chalk and board
Definitely,
is
ma'am.
always the best thing. So we used to have anatomy and all these lecturers who used to come 15 minutes before the class, and they used to spend 15 minutes in front of the board drawing the diagram so that they
Okay,
explain us. So this was back then before artificial intelligence and YouTube came into the role. So now you get bored, visualizing and seeing animated things in front of you for a long time. It's a different, I think it hits different when your professor uses a chalk and he writes what he tells, and you're curious what is going to come up next under that chalk, right?
definitely, ma'am.
And PPT is something like you click the button and the slide is already there. Before you even talk, the student reads the slide and then the topic is over. So I think everyone should join Oracle's live classes. Because this is how here what we are trying to do is we are trying to avoid PPT sessions here most of the time, and the
Okay,
professors are
ma'am.
using pen and the tablets to teach the students. So actually, we're using pen and
Wow.
tablets to teach our students, draw the diagram wherever it's necessary, mark the topics here and there, and so ENT is a very clinical topic, right? So we don't have a lot of diagrams to draw and explain the students, but yet I'm using tablet and a pen at least to write certain things and explain them how to present the answer in the exam hall. So it's just like a life. It's just like how you're sitting in a classroom, but then again, it's on your laptop in your bed.
Yes, ma'am.
Yeah.
Oh God. Like it's such a beautiful platform that is like simplifying everything for a medico these days.
Yeah.
So, ma'am, I have heard like this platform, Oracle is providing mock papers too. Like I have never heard of any platform who is providing mock papers to the student to score in their professional exams. Can you please tell me about this more?
Yeah, so again, we have another team for mock papers. All these are FMG students, students who have already sat for all those exams, big exams, FMGs, iPhones, and whatnot. So these are other group of set of professional doctors who are preparing for mock exams. We have an application. Students can download that in their tablets. I think every medico has an iPad now, right? No
Yes,
one
ma'am.
is using textbook. Everyone is using a digital book. Everyone
And it's
has
the
that.
most mandatory thing once you step into the med school.
Yeah, so I think they can download that application and just subscribe whatever we have and join that Moxie. In India, what we have is that students have to write the answers in paragraphs and certain layout for the university exams. But
Yes,
that's
ma'am.
not the case after you graduate. Everything
Yes,
comes
ma'am.
with a vignette and a question, vignette and certain options which are very close to each other. So you have to prepare for your next exam even before the next appears, right? You have to prepare for the next before you start the next. So you have to
Yes, ma'am.
start preparing from day one, just like how in US students prepare for MLE in their first year and they're in their second year. This is how students prepare
Okay.
for US MLE part one. They have to write those exams before they step into their third year. So next exam is that platform, and I think we created this this question banks there so that we can help those students who are sitting for FMG exams and for next exams so that they can have a practice of those questions and have a habit to do critical thinking on those topics and learn the topics.
That's absolutely amazing, ma'am. Like, I think students are getting everything at a single platform. Like, they be it their preparation for their university exams or next or FMGs or MLE, anything. They're getting all their concepts cleared at one place from one teacher only. So I think Oracle is such a beautiful companion that it is providing all the things to a student and in such a beautiful and interactive manner. And the most important thing that we lack while studying in universities that we are not able to interact with our teachers. And here teachers, the experts like you, like teacher students are freely there, they can share their thoughts, their views, like what they are struggling, what they are going through. I'm like thrilled to know like such a beautiful platform there is for the students. I wish I could restart my MBBS journey with such experts like you
Don't
guys.
do that. You're already
No, no,
done.
no, I'll not. No, 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 I'll not do it. So, ma'am, coming to the last segment of this interview, I'll like to take few questions from our medicos out there.
Yeah.
So, ma'am, what are the challenges that you have faced in like balancing your life as a clinician in this ENT subject, or and then as a medico med educator too? So, how do you balance this whole thing as a clinician also and as an educator also?
I think, we have a saying called practice makes man perfect, right? So you
Yes,
have to
ma'am.
keep on practicing. And that's what my professor, he always told me that now I'll never say that you are a complete doctor. Never say that I finished my MBBS and I'm working. You should always say I'm practicing, no matter how
Exactly.
old you are in that field. You should never say I'm working in certain hospital or I'm working here and there. No, you should always say I'm practicing. because this subject it gives you something new every day. There's something new every day. Human body changes, DNA changes, organisms, they shift. We have shifts in latency, and in everything we have a shift in this field, right? So I think it is very important to balance, and I think discipline is very important. My mother, she was always there. She always taught us to be disciplined. So I think medical students should be disciplined. If you do not have discipline, you will not be able to carry on this journey, even if you have a platform like Oracle.
Exactly, ma'am. You're absolutely right, ma'am. Discipline is
So
the most
discipline is
important thing.
very, very important. Your body should know how to be disciplined. What time to get up, what time to sleep, what time to study, what time to eat. If you know this cycle, I think things will work out their own way.
Exactly, ma'am. So, ma'am, I want to ask you one question. That this profession is so like full of struggles, hard work, sacrifices as a clinician. So what part of job gives you the satisfaction at the end of the day? What
Uh-huh.
keeps you motivated, like what keeps you motivated all the times to balance all the things, to sacrifice even your happiness, the moments with your loved ones, to be there for your students, to be there for your patients?
See, I'll tell this that if we are working in a hospital, it is always satisfying to go back to your bed. If you see that your patient is recovering, that's when you're in a clinical field. When you're an educator, it is always, always beautiful, and it always makes you satisfied when you see your student growing. you know
um,
so there are students who come with zero knowledge. They'll tell, madam, we don't know anything. I have such students who told me in the beginning, we have nothing, we don't know anything. Even if I ask them something, they don't know. But now I see them growing, so that keeps me so satisfied. I feel so happy that I'm able to inject knowledge in someone, and I have some treasure within me that I can share, and which no one can rob. There's
exactly,
no
ma'am.
robbery with that treasure, and it
No,
will keep on going. So if I tell you something, like, for example, if I give you some uh, tip about some medical, like, say, clinical knowledge, like, let's say, I'll give a hint on this orientation now. So I recently found out that uh, a patient, when they are traveling from uh, one hospital, when they are airlifted to the other hospital, okay, and when they are on intubation, when they are intubated.
my God.
So the intubator ball, the balloon of an intubation, it should be filled with NS. So what actually we do is we inflate the NG tube with air when they are in the hospital. But when you have to airlift the patient, you will have to fill it with NS. Why? Because when you take the patient up high in the flight, the pressure will change and
Yes,
that
ma'am.
balloon will burst.
Okay, ma'am.
Okay. So this is what I got. I got this knowledge from someone I follow. And, I'm sharing it on this platform. I'm sure everyone who's listening will have a new thing to know, like, so this will keep on
Absolutely,
carrying
ma'am.
okay, this happens. So, you have a lot of treasure within you that you can, just inject into people, and you can see a change. You can definitely see a change, you know?
It
Yeah.
definitely gives you the kick. I can understand this feeling, ma'am. Absolutely. Now I really feel missed out that I was not having this platform when I was in my first years or second years. So, ma'am, like seriously, I have never imagined of such a platform, like where the preparation is this simplified, like everything is a spoon fed here, and
Yeah,
students
I
are
have
bound to
something to
excel with the
say here.
Oracle. Yes,
Yeah, I
ma'am.
have something to say here. So no matter how much the technology has improved and how many platforms we have to help medical students, including Oracle, right? When we didn't have these platforms, the older batch of students, we didn't have this platform. The treasure that we had, The jewel that we had is that, we had our own time where we could sit privately and study our own subject at our own pace. That is for students who wanted to do this. But now, students who are using these platforms, it doesn't make sense that they pay for this platform and then they don't utilize it the way it should be utilized,
Exactly,
right?
ma'am.
So it doesn't make sense that you flaunt that you have Oracle and you don't use it like the way it should be used. Like if you have an application, you use it as a mock. If you have live sessions, you should attend the live sessions. If you have recorded classes, you should go through it and clear the topics. And you use educators to, get some information, whatever doubt you have. So I think this is how the way you utilize the platform. If you utilize the way it should be done, then I think everything will work out for you.
Definitely, ma'am. So I can conclude from all your learnings like discipline, consistency, and yes, utilizing the whole resource of Oracle that this platform is providing are the most important things. So
Yeah,
I would like to tell all the medicals out there, just don't keep this platform to yourself. Utilize this platform to its fullest, and you will excel.
absolutely.
You will get results. You have to trust your teachers, like these are the expert teachers across the countries, across the globe, who are guiding you, who are teaching you. And personally, ma'am, this interview was so, so informative for me. And it's my pleasure
Thank you.
and privilege to talk to you. Seriously, ma'am.
Thank you.
So thank you so much, ma'am, for this much, much needed session. And all the medicos out there, you know where to find ma'am to get an highest score or to get distinction in ENT. So,
Sure.
so this is your host, Dr. Rishika, signing off for and today. Bye bye. Happy learning. Study